Hello, everyone. Thank you so much for joining. Can you all hear us okay? We have an amazing list starting to build up. Great. Yes. Thank you so much for the early birds. And as we take time to start, please take a moment and introduce yourself in the chat so that we know from where you're joining, what's your name. And also very excited. This is June. So happy Pride, everyone. And let's get started. Let's give a minute and more because let everybody join. It's beginning of the week. People are taking time. Also, if you can see our screen, we have some very, very exciting questions for you. If you have your phone or a scanner with you right now, please do scan. We have some amazing questions. And if you can see it on the screen, and also we will put the link in the chat so that you all can, scan it, join in, and put your responses. Please, let's start responding. Let me grab my phone. Perfect. We have some answers coming in. Great. Okay, we have more responses coming in. Let me just see. Great. We have some amazing people joining us. Thank you so much. Okay, great. I hope you all are able to get the link of the Mentimeter in the chat. Maybe we can post it again for the ones who have just joined. Let me just do it. Okay. Let's give just one more moment. And so we have some responses. Maybe we can go to the next question. Yes. This is a tricky question. Which specific global meeting in June 2026 serves as the final checkpoint before the 2030 HIV goals? As I see so many of you in the chat, I know we all are geared up for this meeting. Great. Okay, and our next question, please. Let's go to the next question. We have most of the answers coming in. And on your phone, you can just scroll up to the next. There are 4 questions. Yes, so which civil society groups are leading the advocacy charge to enshrine self-care in global policy at the UN General Assembly? Yes, please get this right. Yes, thank you. Already 3. Maybe the next question, and then we can start. I see some thumbs up coming. Thank you so much. And the last question, please have a look. We need to put health in hands of communities. Okay, so as you all continue to put answers to this, I am very happy to welcome colleagues, advocates, change makers from around the world. My name is Harjot Khosa, and I'm very excited to welcome you all, and especially from the Advocacy Working Group, but welcome you all on behalf of Self-Care Trailblazers Group. As you all know, why we are here, we are at a historic crossroad. The June 2026 high-level meeting on HIV/AIDS, it's not just another checkpoint on our road to 2030. It's a revolution. We as advocates, as communities, we have led the global HIV response. When during the pandemics, when the clinics were not working, communities, civil societies, we were the lifelines. Where the punitive laws are, pushing communities away, we built our own networks. We reach out to each and every member of our community, each and every woman, each and every young person. The upcoming 2026 to 2031 Global AIDS Strategy, it signals a massive historic shift, as we all know here. It finally moves us away from the top-down, donor-driven and agendas to going to more people-centered, community-owned responses. We are here to declare an end of being passively managed. We are saying that we are reclaiming, we are the owners of our own health, our own well-being, and we are the survivors. Why we are here today? Today, we are here to talk about self-care as we go ahead and prepare for the HIV HLM. I'm very happy that we are joined by 5 extraordinary leaders today who are actually championing this shift. We are here to talk about, how or the ways or the strategies that by which we can put health in hands of communities. And we have to do it now. So with this, I'm so happy and so excited to welcome Dr. Sara Onyango and to come and talk and represent, what is Self-Care Trailblazers Group, why we are here today. So Sara has been leading as a technical advisor, self-care, as a project director, the Self-Care Trailblazers Group. It's a coalition with over 1,000 individuals and 450 organizations. We all are dedicated to advancing self-care in sexual reproductive health and rights. Sara comes with more than 2 decades of experience of advocacy and programming for SRHR. She has worked with amazing organizations in the past, including IPAS, IPPF, US, SAID, IPPF, many government organizations, ministries. The list is long, but I will cut it short and I will request Sara to take over the stage. Sara, over to you.
Thank you very much, Harjot, for that introduction. And thank you, everyone, for joining us on this session today as we begin to build our support for reclaiming the table, for ensuring that self-care is included on the agenda of the 2026 high-level meeting. So I'm just going to start off by giving us a brief overview on what self-care is so that we're on the same page, why we're pushing for self-care to be an essential part of commitments and decisions on health going forward, and also just briefly what the Self-Care Trailblazers Group has done or continues to do to make sure that the agenda of self-care remains in the forefront. Next slide, please. So I just wanted to start off with the definition of self-care, and I'm sure many of you are very familiar with this differently. So for some, it will be healthy nutrition, healthy lifestyles, exercising, taking care of your skin, etc., brushing your teeth, the many things that we do to care for ourselves. But since 2018, we've come up with a much broader definition from WHO that aims to bring out self-care as an essential part of the health system. So the definition is that self-care is the ability of individuals, families, communities to promote health, prevent disease, maintain health, and cope with illness and disability. And an important aspect is that they can do this with or without the support of a healthcare provider. And then at the bottom there, there's just some broadening of the scope of what this definition means. And this definition includes things like health promotion, so creating awareness about health, disease prevention and control, self-medication, providing care to dependent persons, seeking specialist care or hospital care if necessary, and even rehabilitation, including palliative care. I think the most important thing to recognize in the definition of self-care is the role that the individual takes. The individual is responsible for acting or not acting to preserve their own health. And it is this aspect of the individual's involvement in their care that we're working towards strengthening and ensuring that it becomes an essential part of our health systems. Yeah, next slide, please. On this slide, I just wanted to share just a few bullets on why self-care. Why is it important that we push self-care into the health agenda? First and foremost, we know that half of the world's population currently lacks access to essential health services, especially in the low and middle income countries. Whether it's poor people, marginalized groups, such as adolescents and young people, or young women and girls who are stigmatized and therefore do not want to seek care in our traditional health systems, people living with HIV, or even people in humanitarian circumstances or war conflict situations for who the traditional health facilities are probably not accessible. So self-care can be an important strategy for increasing access, especially to these groups that I have mentioned. Secondly, we acknowledge that there's a growing shortage of health workers. There is a shortage and it continues to grow. And it is estimated that by 2030, there'll be a shortage of 18 million health workers. With such a shortage, it goes to without saying that many people are unable to seek services from healthcare providers because they're just not able to reach the populations. And self-care can play an important role in addressing this gap by removing some of the individuals from the health facilities because they are able to effectively self-care for themselves. Self-care can help to address the shortage of the health workforce, but also help to thereby strengthen the health systems, which are already fragile and overstretched. So that's an important point. And by addressing these key areas that I have mentioned, self-care can contribute towards achieving universal health coverage and thereby help countries to achieve the SDG 3, making health systems stronger, making them more equitable, and making them more efficient by diversifying beyond just our traditional health facilities. And we've had experiences with various pandemics globally, COVID-19 being the most one that is in our recent times. And these pandemics, and now we're facing Ebola. Of course, they continue to be threats because of the status of our health systems. And self-care is an innovative approach that can help reduce that pressure and help improve healthcare overall and help us move towards universal health coverage. And finally, I just want to mention that there are many governments that are buying into self-care. It was estimated, I think, at the end of last year, that more than 40 countries have developed national self-care guidelines, and they're at various stages of implementing them, making self-care part of their health systems, including self-care in the national health management information systems, etc. The Self-Care Trailblazers Group, for example, works in 5 focus countries, and these countries are already implementing different strategies for self-care as part of their national self-care guidelines. So self-care is the tool that we need. It is the innovative approach that we need. And we want to make sure that we are talking at the high-level meeting to ensure that self-care is incorporated in any language or commitments that come out of that meeting. Yeah, next slide, please. So I just wanted to I'll quickly run through this slide because Hajot already mentioned the Self-Care Trailblazers Group is a global coalition. We have over 1,000 members, about 50% of them fairly active. We have more than 500 institutions. So we are really like a movement. We're able to help advance the mission, and our mission is to expand the safe and effective practice of self-care so that individuals can better manage their own health outcomes are improved, and the health systems are better equipped. And it's important to just relook at that mission in detail. Sometimes we're not saying that governments should negate their role to provide healthcare. And so in promoting or advocating for self-care, we want to make sure that the individuals are actually empowered to self-care, that their costs are addressed within the financing of healthcare, among others. So that's just more about the Self-Care Trailblazers Group. You can also read more from our website. Yeah, next slide, please. And I just wanted to finalize with sharing with you some of the things we've been able to achieve as we work towards advancing self-care. As I've mentioned, we work in 5 focus countries. They're listed there. And these countries all have national self-care guidelines that have been developed by national self-care networks that are led by the ministries of health. They've developed guidelines. They are implementing various interventions and tracking these to really show that self-care have an impact on health services overall. The Self-Care Trailblazers Group is also involved in advocacy at the global level, and this meeting is part of our work towards advocacy at the high-level meeting on HIV. We want to make sure that global commitments and policies include self-care as a strategy for achieving universal health coverage. We publish a biannual state of self-care report that really brings together learnings on self-care, and the latest report was published in 2025. So you might want to go in there to find more information on where countries are with implementing self-care. And this year we'll be holding one of our biannual self-care learning and discovery series. It's a mini conference. The only conference, I believe, that is specifically on self-care. And again, we're inviting our members to send papers for consideration, abstracts for consideration for presentation at this conference, which will take place in October, November. And then finally, we engage with all our members annually, because we want to hear from you. We're a coalition, and the decisions we make, the strategies we propose, are vested on your input as well. So you're also welcome to take part in the annual member summit and share your experiences and your lessons and best practices. And on the last slide, I just have a list of people from the Self-Care Trailblazers Group, should you be interested in getting any support. Yeah, you have the contacts there, and you can reach out to the Secretariat for information. Thank you very much. Back to you, Harriet. Thank you.
Thank you so much. Thank you so much, Sarah. You have set the tone for our today's discussion. You have actually very clearly set the stage for why health systems must adapt to human realities. That's why we all are here today. And we all know that self care strengthens every health system. Self care is the center point where system support meets personal power. So I have seen it in field, and I totally support this point that we are here, we are talking about self-care at the point when we are going ahead, paving way, claiming the table as the HIV HLM happens. So thank you so much, Sarah. And with this, let's, have another fierce discussion. And I'm very, very excited that we have with us Florence. And Florence Raikonam, she is the co-executive director of Global Network of People Living with HIV. She's a transformational feminist leader who champions community-rooted activism to dismantle systemic stigma. She fights criminalization. She demands universal treatment access. Previous to this, she's worked across Love Alliance, EPIC initiatives. She leverages powerful alliances with UNAIDS, WHO, and she has aggressively mobilized communities to recapture. We are talking about recapturing here, recapture the bold spirit of early AIDS activism. Yes, we need to bring that back. And she is ensuring that diverse populations living with HIV take their rightful place in global decision-making spaces as we shape the future of health policy. Very, very important. So thank you so much, Anam, and thank you so much. Can you please tell us how do we ensure that the 2026 to 2031 strategy anchors itself genuinely in community leadership? So with this question, over to you.
Good morning, good afternoon, good evening from wherever you are. What an interesting way to have been introduced. I'm still absorbing it. Thank you so much. I would just like to start from your question, which looks like a central question before us. How do we ensure that the 2026 to 2031 Global AIDS Strategy that is at the high level meeting political declaration discussions at the moment anchor itself genuinely in community leadership? I believe the answer lies in placing self-care at the core of our interventions framework. This approach, as you rightfully said in the beginning, shifts us from top-down interventions to individual and community agency. As people living with HIV, myself included, self-care has been a part of our lives. It continues to be. It entails consistent responsibility for our health, demonstrated through taking the pill every day, dedicated adherence to our treatment, attendance to clinic appointments, and meeting those appointments when we should have them, and safeguarding our overall well-being despite systemic barriers. For many individuals confronting diverse health challenges, it signifies assuming charge of one's health when clinics are distant, stigma persists, and poverty compels many of us to have difficult choices between basic needs and essential medicines, sometimes for opportunistic infections. We now stand at a very, very pivotal point. The Global AIDS Strategy offers a historic opportunity to embrace self-care as the foundation for genuine transformation, as Sarah has just told us. It, in my view, is beyond just policy. It also serves as a pathway for innovation, for advancing differentiated service delivery that has been critical to keeping people living with HIV on treatment and staying alive. Through optimized treatment, prevention, and point-of-care diagnostics, we empower informed decision-making for our health. So ideally, investing in self-care strengthens health systems. I feel like this vision rests on three essential pillars. One, and most significant, is health literacy. Clear, timely, stigma-free information, recognizing that people, when informed about their health, can make the decisions that are needed for them. A good example has been the U equals U movement, where people living with HIV are currently educating ourselves on the benefits of HIV science. When a person living with HIV adheres to their treatment and are virally suppressed, then they cannot pass this virus. This message has significantly, data shows us, improved testing, improved adherence, viral suppression, and of course, has in its way helped to drive down HIV new infections. But information is not enough. We need practical tools, self-testing tools, self-screening for pregnancies, for HIV, for other diseases, PrEP, take-home prevention options that do not require us to be at the facility all the time, dual or multiplex diagnostics that help us address more than one disease at a time. These convert service availability into genuine access. And third and most importantly, an enabling environment, freedom from shame, reduced wait times or other challenges that happen at facility level, integrated mental health support that is needed, affordable nutrition, and most importantly, equitable financing that eliminates this tension between survival and treatment. For UHC to happen and happen effectively, we cannot leave people behind because of costs to healthcare. These three pillars elevate self-care from personal practice, and they are really essential. I just want to pause here and share that GNP Plus did ask over 1,800 people participated in a survey that brought us the report, People Living with HIV, Minimum Requirements for Integrated HIV Services. It offers vital guidance right now based from people living with HIV and what they feel is needed, emphasizing transformative participation, context-specific models that place people living with HIV and those impacted by HIV at the center of decision-making. But we are not starting from scratch. I am excited to today join the Self-Care Trailblazers Group, but I have been speaking about self-care for a couple of years now and was also involved in other discussions. The WHO has recognizes self-care interventions as critical to advancing primary healthcare, and Sarah shared the guidelines and the specific definition, and it leaves no one behind. The guidelines for self-care by WHO are supported by implementation examples that I have seen: Zambia, Kenya, Uruguay, Uganda, Morocco, others that I may not mention, demonstrate how country leadership and interventions driven towards UHC that reinforce primary health systems, make them resilient, and promote health equity for all. While it is also an opportunity for inspiring future innovation, policy development, and scale-up research. Colleagues, the HIV response has already showed us what is possible. As Harjot was speaking at the start, over 20 years ago, treatment was scarce for many of us, and palliative care was a big part of our HIV service delivery model. As community health workers at the time, actually in my office, it didn't matter what role you had. You were assigned 2 houses and you made sure to go to those houses to provide care as a community health worker, even if you are an accountant or a programmer. When people living with HIV are fully included in our own health journeys, our individual actions ripple outwards, impact families, communities, and entire populations. These proven lessons built on an incredible foundation of community leadership must now propel us forward. Let this 20 person-centered care, for which self-care is a very big foundation of, and agency by anchoring strategy in self-care and community leadership. By doing so, we move people, everyone, from being passive recipients of interventions in health to visionary architects of health equity. And because I come from the HIV field, this is how we will end AIDS and achieve HIV control. Thank you, and back to you.
Thank you so much. Thank you so much, Florence, for those strong words, personal reflections. And yes, you took us back, but we are very happy that you were able to share with us today. And I know this point today, it's a vital reminder that our policies need, if our policy needs to be robust and if our policies need to be stronger, we need to value the expertise of the communities that are living those realities. We need countries to start taking a little more ownership, considering the recent global shift that's happening. But yes, our rights, our health, our voice. And when community leads, then only health can succeed. So thank you so much, Florence. Thank you so much. And yes, with this, let's move on to our next amazing speaker. And we all know no UHC without us. And self-care is the foundation for global health justice. And to talk about it today, we have our speaker here, Ileana Monteforte. Ileana is a global health advocate, and she will help us understand that how UHC and how we are talking about self-care and how we are leading to the broader fight for health equity. So Ileana has been here for last 20 years, experiencing advancing health equity and universal health coverage. In her past roles at the Global Health Council, she elevated community voices within the global policy. She has held key leadership positions in major international bodies, including UHC 2030 Civil Society Engagement Mechanism, UHC Civil Society, WHO Civil Society Commission, and she has partnered with many governments, multilateral institutions, and driven the people-centered policies for communities. She brings meaningful community participation and strong local leadership when we are talking about global health improvements. So Ileana, please come and please tell us, help us understand why universal health coverage remains a dream without integrated self-care into the HLM political declaration. So over to you, Ileana.
Thank you, Harjot. That's really great to be here, and thank you for the wonderful introduction. I wanted to start off by reminding us what the definition of universal health coverage means, and it's that all people have access to the full range of quality health services they need, when and where they need them, and without financial hardship. So it covers the full continuum of essential health services, from health promotion to prevention, to treatment, rehabilitation, and palliative care. And it's really important to understand what we mean by this goal of universal health coverage vis-a-vis where we are now. And as per the 2025 UHC monitoring report that recently came out, around the world, we're seeing that billions, not even millions anymore, but billions still lack reliable access to clinics, medicines, providers, and preventive care. So we're also seeing that health systems are overstretched by chronic disease, something that we saw a lot in the discussions around the high-level meeting on non-communicable diseases. We're seeing aging populations, pandemics, conflict, and still many, many workforce shortages. Yet in the midst of all of this, people already practice self-care. And I know Sarah did a great job talking about the definition of self-care. I'm just going to provide some examples here. But they include home blood pressure monitoring, HIV self-testing, contraception access, mental health practices, diabetes management, telehealth and digital health tools, nutrition and preventive behaviors, managing chronic illness, monitoring symptoms, making reproductive health decisions, and caring for children and elders. So the question here is not whether self-care exists. I think we can see and acknowledge that it's already happening. It's whether systems recognize, support, and invest in it equitably. So I'm going to discuss how self-care, the role that self-care plays in universal health coverage, and also why it matters so much in achieving universal health coverage. So first, self-care expands access. So when we talk about universal health coverage, we have one phrase that essentially sums up, what our overall goal is, and it's leave no one behind. So self-care actually helps us achieve this goal because it reaches people traditional systems often miss. So when I talk about traditional systems, I mean rural communities, women and girls, migrants, people with disabilities, low-income populations, and marginalized groups. It also reduces geographic, financial, and social barriers to care by empowering people to manage their own health without having to seek healthcare when it's not necessarily needed and it's something that they can be empowered to do. So the second is strengthens health system capacity, and we already heard a little bit about this from our former speaker, but it empowers patients to reduce avoidable strain on clinics and hospitals. Self-management of chronic diseases can improve outcomes and reduce health costs. So educating people and empowering them to manage their diseases at home can prevent them from developing complications that then can imply a lot of health costs over time at primary, secondary, or even tertiary hospitals. And then we have community-based care. It allows health workers to focus more on those complex cases. Three is advances equity and human rights. So health justice requires autonomy and informed choice, and empowering people and educating people around their bodies and how to take care of their bodies and make the right choices for their bodies is all part of health justice. Self-care also supports bodily autonomy, reproductive rights, and informed decision-making. And people should not need wealth or proximity or privilege to manage their basic health needs. And again, this is part of our goal of leaving no one behind. No matter what your financial situation is, you should, or even your education, you should always have your bodily autonomy, and you should always have access to your basic health needs. And self-care helps us reach that. And then the fourth is it builds resilience during crises, which I think since the COVID-19 pandemic, we've really seen this firsthand. So during pandemics and disasters and conflict, self-care becomes really essential, especially when people don't have access to hospitals or health facility or clinics. COVID-19 demonstrated the importance of home-based care and digital health and community health literacy. And resilient societies depend on informed and empowered populations. I do want to just end here by mentioning an important health equity message when we talk about self-care. And self-care must not be an excuse for governments to withdraw responsibility. There's a huge difference between empowering people and completely abandoning them. And effective self-care requires affordable medicines, it requires accurate information, digital access, community support, trained health workers, and strong public health systems. And this is something that governments are responsible for and must provide so that self-care is productive and communities can practice it effectively. So equity must guide the implementation so self-care does not widen existing inequities. With that, I'm going to stop because I know that we're going to have a question and answer session where we can talk a little bit more about calls to action to our governments, but I'm going to hand it back to Harjot for our next speaker. Thank you.
Thank you so much, Ileana. Thank you so much. That was something that we needed at this point, and you have created a base and pivoted us to the next discussion. And cannot agree more with you that universal health coverage is not complete without self-care. When we empower individuals, when we empower communities to manage their own health, we strengthen the entire health system from the ground up. So thank you so much, Ileana. I loved it. And with this, let us move to our next very, very important discussion. When we are talking about self-care, when we are trying to put self-care into practice, we need evidences, we need community models, we need cost-effective pathways, because that's what self-care is. And to dive more into it today, we are very happy that we have Dr. Karen Hotzel with us. She is a world renowned public health physician with more than 30 years of experience, and where she spent a lot of time leading healthcare interventions in Southern Africa. Currently, she's one of the directors managing HIV, TB, viral hepatitis at PSI, and the very, very important self testing project in Africa. She specializes in scaling innovations from research to global policy practices, particularly in biomedical HIV prevention, PrEP, self-testing, very, very important. And we are going to have some amazing set of slides where she brings her knowledge of developing so many guidelines and working with so many ministries in low resource health settings. So with this, Karen, welcome and thank you so much for joining us. And we are really, really very keen to understand that. Please walk us through some evidences and how, and we know self-care is important, but we need some models which you have. So over to you, Karen.
Thank you so much. Thank you very much for the introduction, and thank you very much for the opportunity to contribute to this important discussion. So my talk will be about HIV self-testing as one of the strongest examples for self-care in practice, and what we have learned about the public health value in its role in community-led delivery and potential to sustain HIV impact in a very constrained funding environment that we're finding ourselves with HIV. Next slide, please. So just again, speaking about sort of self-care and self-testing, the critical to health systems, and I think have heard it earlier on already, to achieve universal health coverage, we must complement the traditional provider to client model that is at the heart of health systems to a self-care model. And self-care interventions are amongst the most promising and exciting approaches to improve health and well-being from a health systems perspective, and that is what I speak about, and also for the users of these interventions. So self-care interventions have the potential to increase choice and autonomy when they are accessible, acceptable, and affordable. Self-testing as self-sampling, that is the focus of my talk, have become increasingly important to fill the gaps, the diagnostic gaps for many infectious diseases. And it's not only for HIV, we've done also work on COVID-19, self-testing, viral hepatitis, very important also as an access point for diagnostics, and to provide an alternative to conventional testing services that are convenient, private, and increasing access. So self-care is often framed around autonomy, dignity, and the right for people to make decisions about their own health. But the public health case is equally strong. HIV self-care can increase engagement and autonomy, expand access and equity, improve quality of care, reduce costs for both health systems and individuals, and increase efficiency. So for HIV, it's particularly important as we are asking health systems to sustain prevention, testing, treatment, and care with very few resources now, and fewer healthcare workers, and increasing demand. And self-care helps bring services closer to people while allowing formal health systems to focus their capacity where clinical care is most needed. I think this is the major argument for this. Next slide. Very quickly, speaking about the self-testing investment framework that was underlying the framework for the work that I was involved with over 9 years on the STAR project, that provided sort of the underpinning, the evidence agenda for the STAR project, for HIV Self-Testing Africa project, that provided the evidence for the paradigm shift in HIV testing towards HIV self-testing. It helps us also to think about HIV self-testing not only as a diagnostic tool, but also as a broader health systems interventions. So HIV testing is a gateway. not the endpoint, to prevention, treatment, and sustained HIV impact. And there are several impact pathways for HIV self-testing. A negative result can link someone to HIV prevention. Very important now with very effective HIV prevention interventions like PrEP, long-acting PrEP with lenacapavir, for example. A positive result can link somebody to confirmative testing, and that is absolutely required for HIV self-testing, and then to antiretroviral therapy access. For people living with HIV, self-testing approaches can also support disclosure, partner testing, and linkage, relinkage into care if they have moved out of the health delivery system, to increase its retention. There has also other product effects, and I will look at this as well. Cost and time saving for users and health systems, improved coverage, greater equity of access because we're increasing the access points for people to access testing services, and also reduced costs and pressure on health clinics. The key point is that HIV self-testing creates value because it simplifies access and opens multiple pathways to prevention, testing, and care. Next slide. So a bit of the quintessence, actually, as you know, WHO is recommending HIV self-testing based on the evidence that were gathered through the work that we have conducted, and the evidence that we have for HIV self-testing is now very strong, which has contributed to the WHO recommendations. And lots of this work that contributed to the evidence was done by the STAR project. So HIV self-testing is now recommended by WHO and should be offered as an approach to HIV testing services and an alternative approach. It can be used to maintain essential services as an additional testing option in facilities and as part of PrEP and PEP delivery. We now have multiple quality assured HIV pre-qualified products. We have 7 products, oral fluid products, as well as blood-based products. And we have also very low cost options now, which further increases the cost effectiveness of HIV self-testing. HIV testing has also been shown to be safe, accurate, acceptable, and feasible during all the research that we conducted on this. Importantly, it also increases uptake amongst people who are often missed by conventional services, including men. They are missing in the first 95 and in the cascade and treatment cascade. Young people, key populations, first-time testers, and people who face stigma, distance, and time or confidentiality barriers to accessing testing services. So this evidence shows that HIV self-testing can be empowering and has not been associated with any social and clinical harms when implementation is happening and with appropriate support and referral pathways. We have also tested AI-enhanced digital technologies that are important for linking people into care and treatment, and for providing information on how to conduct a self-test so that self-testing is safer. So HIV self-testing is affordable, cost-effective, and can lead to substantial cost savings when adopted. Next slide. So very important now, I will be speaking a little bit more about the distribution modalities. There's a wide range of distribution modalities that can be adapted, and that is really important. Our strongest lesson from HIV self-testing is that the delivery models are mattering. And HIV self-testing is very flexible. It can be delivered through community-based campaigns, peer-led models, secondary distribution from people who receive the self-test for their partners, for example, partner distribution, social network distribution, and also can increase efficiency of facility-based self-testing through facility-based triage, workplace programs, pharmacies, private sector channels, and also through digital platforms where people actually can order their self-test in combination with also ordering their PrEP supply. So this flexibility makes it really very powerful. As I said before, HIV self-testing increases the access point where people can access it and increases equity of access. So different population needs different access points. Men may reach out to workplaces and community models. Key populations may prefer peer-led or community-trusted channels. And a lot of our investment went actually in community-led initiatives for self-test distribution. Facility clients can use self-testing to reduce waiting time, and that also obviously reduces the provider workload. The innovation is the ability to redesign HIV testing around people's lives and where people want to access testing services. In the following slides, I will be discussing a bit more the couple of evidence areas that have contributed to the global recommendations for HIV self-testing, including the service delivery models that were effective, as well as speaking about cost and cost effectiveness. Next slide, please. So the evidence from community-based self-testing, and here example from Zimbabwe and Malawi, we have evidence for this was generated in multiple countries, obviously, and a lot of pieces. I'm just showing you as an example. This was the early proof of concept for self-testing with community-based distribution. So we could show that during campaign periods where self-testing was intensified through community-based door-to-door distribution of self-test kits, we could increase testing uptake for testing for people who have not tested before between 42 and 50% in Zimbabwe and Malawi. In Malawi, door-to-door distribution was also associated with higher recent testing compared to areas without HIV self-testing, and that was done during a randomized control trial. It was after adjusting the relative factors in the analysis, door-to-door HIV self-testing distribution was associated with a 16.1% higher percentage of recent HIV testing compared to the comparison group. The slide also shows another important point. HIV self-testing can also support linkage into care. So in the HIV self-testing campaign areas, as compared to the areas where self-testing was not distributed, there was an increase in ERT initiation around the campaign period, and an increase in ERT uptake by 35% as compared to the control clinics. So this demonstrates that HIV self-testing contributes to case finding and treatment initiation when it's connected to clear referral and linkage systems. Next slide. Let's go now more into the costs and cost effectiveness of HIV self-testing. Is really, really important. This is a summary of the multiple costing and cost effectiveness studies that we conducted, and also based on a literature review of HIV testing modalities, including HIV self-testing. So HIV self-testing costs vary by model and context. For example, cost per kit distributed have ranged from about $7.9 to $14.8, depending on the distribution modality. More expensive for secondary distribution in South Africa, for example, and also in terms of community and workplace distribution, Eswatini, about $18.9 per test distributed. What we found in the quintessence of assessing all the costing models was HIV self-testing can achieve lower cost per person tested than standard testing, especially when uptake is high, linkage is strong, and programs operate also at scale. So there are economies of scale with HIV self-testing implementation in terms of cost reductions. Higher uptake, better targeting, strong linkage, and efficient distribution are the main drivers of cost effectiveness of HIV self-testing. Next slide. A little bit more about costing here. Facility-based HIV self-testing, which was not the focus initially of our interventions, but becoming more important now in the current funding environment. And as you probably have seen, WHO has provided recommendations potentially for using HIV self-testing as in replacement for the E1 test and in constrained, resource-constrained environments. Because it could reduce, the costs for HIV testing based at facility level. So low-cost HIV self-testing can help fill the human resource gaps by reducing at healthcare facilities by reducing the amount of healthcare worker time required for routine testing. So a lot of the cost for HIV testing at facility level is actually going into human resources. Yeah, this matters because healthcare worker time is one of the most constrained resources in the HIV program. The modeling that we're showing here show that routinely using HIV self-testing in facilities can generate savings, particularly when staff time is reduced. Even when considering scale-up costs for self-testing, overall cost can remain lower and staff time can fall substantially. This means HIV self-testing can help preserve services access while allowing healthcare workers to focus on clients who need clinical assessment, confirmative testing, ERT initiation, PrEP initiation, and more complex care, rather than spending their time on testing people, where self-testing can be introduced as a very efficient and effective way of increasing coverage at healthcare facilities for self-testing. Thank you. Next slide. Another very important aspect and use case for self-testing is now HIV self-testing has the power to transform HIV prevention. So HIV self-testing is an entry point and very critical for HIV prevention. Globally, we still have 1.3 million new infections annually, while in 2030 goal is that we want to reduce this to fewer than 335,000 new infections. We cannot reach that goal if HIV testing remains too difficult, too facility dependent, or disconnected from prevention options. So self-testing can simplify the prevention pathways. It can support PrEP initiation, PrEP continuation, PEP access, partner testing, and re-engagement, and becomes also even more important now as long-acting prevention options like injectable PrEP or long-acting oral PrEP with the introduction of MK8527 become available. These products will require testing models that are flexible, accessible, and scalable, including models that move beyond traditional clinic-based delivery. So self-testing can undo that bottleneck that we have as testing in access to prevention services, and especially in access to PrEP services. Next slide. One more example here, very important for scale-up, is the pharmacy-based HIV self-testing that can become game-changing. This is a model that describes, that shows, enables self-care that is particularly important for today's discussion. The model looked at broader community-based access to HIV self-test kits, PrEP, and ART through pharmacies and community-based healthcare workers. The findings are very powerful. Enabled self-care is more than doubling testing coverage in this pharmacy-delivered model from 5% to 12.7% for adults tested every 3 months. It also reduces HIV-related deaths by 18% and HIV incidence by 27% over 10 years. And over a 50-year period, it was able to avert 34,000 deaths with reduced program cost by around $6 million, and was cost-effective in 95% of modeling settings with the strongest value in higher prevalence context. So the savings come largely from preventing advanced HIV disease, reducing expensive clinical care, and reaching people earlier with prevention and treatment through this pharmacy-based HIV self-testing model. Next slide. So based on, this is the made a quintessence in the summary point for my presentation. HIV self-testing is no longer innovation, but a necessity. And this is based on the editorial that summarized the evidence and call to action based on the evidence and roadmap generating by the STAR project. This is part of a publication. Next slide. So next slide, please. Let's summarize this in the next slide. Can you move to the next slide? I cannot see it moving. So yes, so the lessons from the evidence is clear. HIV self-testing is no longer a novelty. It's no longer just an innovation. It's now a necessity. And today's constrained financial landscape, we need flexible, resilient, locally driven models. HIV self-testing can safeguard hard-won gains by expanding access, reducing pressure on facilities, supporting prevention, enabling people and communities to take a more active role in their health. The future is not HIV self-testing in isolation. The future is HIV self-testing linked to a larger self-care agenda for HIV linked to PrEP, PEP, ART, SRH, digital tools, community systems, and primary healthcare. And this is how self-care becomes part of a stronger, more sustainable public health system. So some closing and call to action is we need bold action to embed HIV self-testing into routine service delivery. Second, we need to streamline policies that allow HIV self-testing to support testing for PrEP, PEP, re-engagement, and broader prevention services. Third, we need stronger partnerships with communities, pharmacies, the private sector, and health delivery and health systems leaders. And fourth, we need better use of data and digital tools to support demand creation, linkage, follow-up, and continuation while protecting privacy, trust, and equity. And that includes HIV self-testing. So my final message is self-care is not a second best option. Self-testing shows that self-care can expand access, protect dignity, reduces pressure on health systems, and delivers strong value for money. Thank you very much. My next slide is just acknowledging the contributors to this presentation. Thank you so much.
Thank you so much, Karen. Thank you so much. These models are so inspiring. And definitely, we agree with you that self-care is an efficient, right-based, and highly resilient component of modern public health that save lives. And I loved it when you said that HIV testing is the gateway to both life-saving treatment and highly effective preventive services. And yes, keeping fingers crossed for Lenacapavir, because that is the game-changing step. By you just have 2 injections and you're done for the year. So 100% protection. So thank you so much, Karen. These are some very, very important points, and we will continue this discussion of learning more from the models. Okay, reclaiming the table. And we cannot reclaim the table till the time we have some very strong young voice with us. Our final panelist, she reminds us that this movement belongs to next generation. Please welcome all of you. Please welcome Fatima. And I don't know where to start, and because about amazing Dr. Fatima. She's a Moldavian medical doctor, a sexual reproductive health rights and justice advocate who is training to become a gynecologist. We need more gynecs like you, Fatima. She began her career as a peer educator, later completing comprehensive sexuality education and many sexuality courses. She is currently serving as the governance board member of one of the member associations of IPPF in Maldives. She is the country representative to many young forums at regional and global level, including Southeast Youth Health Action Network. And she has been representing Maldives and South Asia at many forums. She's currently doing a lot of work which involves research on family health. And she is driven by the passion for holistic public health well-being while integrating the social aspects. So with this, Fatima, we need to talk about autonomy. We need to talk about reclaiming our rights, our health, our sexuality. And as a young person, please reclaim this floor or claim this floor. It's yours now. Thank you.
Thank you, Harjat, and greetings everyone who are joining from different parts of the world. It's truly an honor to be here. As Harjat has introduced me, I have been in this advocacy field for about 11 years. I was just a clueless 16-year-old when I first entered into it, but my passion has kept me going. It's truly an honor to be attending here, but more than that, it's a privilege to speak and bring forward the perspectives of the youth. So as I sit here, I can recall hundreds of times where the word fight has been said in many occasions like today, which I believe speaks volumes because it is indeed a huge battle for the young advocates who have been fighting for. And with the experience of in the SRHR field for over a decade, I must acknowledge the significant fight for the autonomy, the call longing to reclaim our bodies, and taking our own health into our very own hands. This has been long overdue. The challenge also has become enormous, so must our efforts to combat this issue as well. Next slide. So because if you look at the bigger picture, almost a quarter of the population falling under the universal healthcare coverage are made up of the young people. And there is another significant group of children who will be the younger generation of tomorrow. Let alone that young people also account for half of the new cases, with numbers being above thousands globally on a daily basis. So this is how significant HIV self-care has become for the young people. Next. So today I'm not here just as a young person in the room, but also a provider. I'm a young medical doctor who recently graduated, and it takes me back to my ethics classes, to this Venn diagram that you see, where all the principles of medical ethics are given equal importance. So why are we still facing the challenges in giving the autonomy to the young people when every aspect or when every element of medical ethics has an equal importance? As we resume our efforts to shift the narrative from pre-manufactured forms of passive care, which are narrated by some authorities at higher up with no voices of youth being included, to individualized young people-centered care, we must acknowledge the importance of autonomy and also reclaiming our bodies in the process. Next. Now, let us take a glance on how the HIV prevention and care component is integrated into the UHC and how is it applicable for the youth. So first and foremost, the universality of care, which is a core principle of it, where integrated models are used in the access and it is expanded to the level of the primary health care. It must be ensured. And secondly, the mechanisms of delivery of care where other relevant stakeholders such as the youth-led organizations are involved. As we believe having that door open is a safe space for the youth, which will enable for us to move towards self-care with avenues that are more youth-friendly and also which will help the vulnerable and the marginalized young groups to be felt more welcomed to seek care with young hearts in mind. And on top of it, it also says it's important to have strategies tailored and ready for the catering of the key populations. And this is where young people fall into. And micro-targeting the service coverage where young people are the center of the stage. Next. As we continue, we must also take this space to acknowledge while the legal young adults might have access in most of the areas across the globe, there remains a certain age group of young adolescents, particularly the ones who are below 18, where in some parts of the world they might require a parental consent to seek care. So while in some developed countries like the UK, the health system utilizes and applies principles of Fraser guidelines, also what is known as Gillick competency, which means simply a young person has the capacity to understand the gravity of the health issue and they understand the impacts of the treatment given. So as long as they're deemed to have this Gillick competency, I want to emphasize on point A and B, as you can see on the screen, where, for example, if somebody came to me, if I were a doctor in UK and if a young adolescent came to me to seek, for example, contraception services, so if I believe that person has the Gillick competency to make the decision, I must provide it. So on this basis, why cannot the same principles be applied to the young adolescents seeking care for HIV and also empower them with self-care models instead of their age being a hindrance to access proper and timely care? Next, please. So what do we want the whole health policy makers to ensure when they're deciding things for us? So we demand for the young people to have proper right to information and confidentiality. With the right, especially self-care being on the table, the right to information is so important. And when it comes to confidentiality, that also includes parents, if the patient does not want, or if the young person does not want the parent to know, we must respect that. And that would lead the young people to be equipped with the capacity to be the architects of our own health and well-being. We also demand for expanded access to self-care without having to justify before an authority or even having to jump through bureaucratic hoops, which are more massive than the virus that have gotten contracted with, and which in turn will motivate them to be the champions of their own bodies because we do have easy access to care through self-care models. We also demand for youth-friendly providers. By youth-friendly providers, I mean providers who are free from stigma, taboo, and judgmental attitudes, which will make the young people more at ease to seek help. And again, this is again very applicable for to seek self-care. And we also demand for a seat at the decision-making table. And the young people no longer want to be accepting decisions made without the say and voice of the youth being heard. By giving a seat at the decision-making table, we are also empowered with accountability both at policy level as well as at an individual level to be more accountable for our own health as well as self-care. And as a young advocate, I also want to highlight the importance of having youth-led advocacy movements. So in my experience, advocacy movements without being youth-led or without the involvement of the youth, it has only been an utter failure. So we want more youth-friendly approaches such as digitally profiled advocates, popular among the youth being at the forefront of the advocacy, and digital health interventions being the core of the self-care models developed for the youth, because nothing for the youth will be complete without the youth involved at all stages of care, and with the beacon of hope of having a more empowered and a more resilient younger generation who have the autonomy to their own bodies and healthcare. Thank you so much.
Thank you so much, Fatima. Such powerful choice of word as always. It is always a pleasure to listen to you and to talk to you and to understand the perspective you bring to every discussion. And definitely, youth autonomy is not negotiable, and more power to the youth. And I want to say, we decide, but youth decide. So, thank you so much for this amazing discussion. And we have a lot of questions coming up, and we have a lot of things flowing in the chat, in the question answer round. And I encourage other participants also to please ask. Also, with this, we move to our next segment, which is question answers. And before we dive into more questions, I have a request and urge to all the panelists. We need to talk. The 2026 high level meeting is our final global checkpoint before 2030. Words printed on paper will not save lives. But what is your single most urgent call to action to urge member states, donors, to drive community led self care as a fundamental human right? So, with this, I open the floor for all our speakers today. And starting with Sarah, do you want to come in first?
Thank you very much, Hajat, and thank you everyone for such excellent presentations on this important topic. I think from where I sit, our call to action would be for the high-level meeting to recognize and support the integration of self-care into national health systems. So we need to make this a policy, as self-care is one of the key strategies that countries can use to achieve universal health coverage. Thank you.
Thank you, Sarah. Thank you so much. This is very important. And building on this, Sarah's amazing point, I request Florence, please come. I know you've been pushing. I've seen your other interventions as a fangirl, but on this point, what is your call for action?
I think I will make my call this way. The member states need to reaffirm the critical role of two sets of targets. The first one is the 10-10-10 targets. One is on stigma and discrimination, reducing that to under 10%, addressing gender inequality to under 10%, and addressing unfavorable and punishable laws to under 10%, because this will give us an opportunity for engagement, for ownership, for agency to channel self-care. And of course, complement what Sarah has asked for. Number two, and most importantly, the community targets, the 30, 60, 80 targets that have targets on the percentage of interventions on testing, on treatment, and on community engagement. So once those are reaffirmed in the political declaration, take it down to country level and institutionalize mechanisms for community engagement and leadership. So whether be it inculcating them within policy, what would be the role of community, and then self-care embedded within what communities will do, so that we are activating person-centered care from policy, because then that's the only way we can be able to hold each other accountable. Thanks.
Thank you so much, Florence. It's like we are making the tree, of our call to action. Sarah did the base health system. You have built on it with communities and targets and branches. And with this, we come to Ileana holding the UHC umbrella. That what is your call to action to complement our tree here, Ileana?
I think for me, it would be not only for governments to commit to develop policy, but also to commit to co-designing solutions with communities. I think policies work best when communities help shape them. And I know one of our participants asked a question about culture and how that affects, people's ability to participate in their own care. And I think that when you have communities lead the development of policy, but also be a part of the implementation. The community and community leaders are who people trust. And so the more that you have them involved, I think the more people will want to pick up, a lot of these different interventions around self-care and will have a lot more confidence in the different tools that are being offered to them to be able to take care of themselves. And I'll just end by saying that health justice, since I'm talking a lot about this and we discussed UHC, it means not only giving people treatment, but it also means giving people power. And I think putting people in, governing positions and in positions where they can actually develop policy and implement policy, give them, power. And I think that is incredibly important in being able to achieve UHC, and trust in communities is really key to that too.
Thank you so much, Ileana. Yes, more power to health justice and gender justice always. So you have completed our tree. And with this, I come to Karen. Your models are the roots or what's happening at the community level. That's what you taught us. And we loved it. So please, what's your call for action?
Yeah, I think I just repeat the points that are already made. We need really a bold decision now to embed HIV self-testing in routine service delivery. We need to ensure that we have policies that support the integration of HIV self-testing everywhere. We need to scale up HIV self-testing because it's an entry point for prevention and treatment and care. I think more investment, more realizing what the solutions are with HIV self-testing as a very important self-care intervention.
Wonderful, wonderful. Thank you so much, Karen. You bring this community, experience and from the field. Thank you so much. And with this, Fatima, you are the future. And you have already given us enough food for thought in your discussion. But any last word on this?
Yes. So in short and sweet, I would say to remove the tokenism around it, because I believe the reason why the fight for autonomy it still continues to this day and age is because of the tokenism that revolves around it. So yeah, just please remove the tokenism and not just say empowerment of the youth or the youth friendly services, but actually walk the talk. Yeah.
Wonderful, wonderful. Thank you, Fatima. With you on this. And I will not say that I correct myself, not future, but the epicenter of our discussion, young people, epicenter of our response. Thank you so much. So with this, I open the floor for more question and answers. I see so many questions that have already been answered in chat, in the question answer window, and we will continue to answer and ask more questions. And with this, I start with my first question. So for practitioners and advocates looking to complement clinic-based models with person-centered approaches today, what is the single most critical non-negotiable step they must take to empower communities? Sarah, can you take this question?
Thank you. Thank you for that question, Hajat. I don't know that there's just one single step in this process. I think it's a series of steps. But if I were to say one single one single thing. It's one, first and foremost, recognizing that the individual has the capacity to manage their own health and being willing to support them. So we see providers who are anxious about empowering individuals to manage their health, thinking that they will not be able to do it safely, correctly, accurately. And so we need to support the providers to overcome that. And the most important thing is to build awareness of the providers and also support the providers to build awareness of the client. So it's a two-way thing. The providers need capacity building so that they're able to support the individuals, but the individuals cannot self-care without being trained at least on specific interventions, etc. So yeah, we want to address the stigma among the healthcare providers. Individuals can actually manage their healthcare very safely, and data, statistics, evidence shows that they can do that. Yeah, thank you. I know I've gone roundabout, but yeah, thank you.
Oh, no, wonderful, wonderful. Thank you so much, Sarah. This is what we wanted to hear, and we want to hear it again and again. So yes, thank you so much for this reminder. And with this next question coming up, Florence, can you please take this up? We are currently witnessing an intense global right-wing uproar targeting bodily autonomy, sexual reproductive health rights and justice, especially of LGBTQI plus communities, women, marginalized populations. How can the 2026 to 2031 Global AIDS Strategy use self-care as a political and structural shield to protect individual health rights against this coordinated conservative political pushback? Yes, Florence.
So I'll give two ways, I think, because one will be sort of like policy driven, and the other I feel like is just from my heart. So one, the Global AIDS Strategy is anchored on a set of targets and measured deliverables. On those targets are indicators in which governments will be able to measure progress. The 10-10-10 targets I talked about and the 30-60-80 are targets that people are able to use evidence of what record cases of violence or record progress in stigma reduction. And I think it is important that we use those opportunities to be able to share what's actually happening and not stop, because when people know what is actually happening, then it will be useful to give an opportunity to address what's happening. So that's what we can sort of do with the strategy. But the strategy in and of itself and the political declaration, which will be anchored on the strategy, has three ingredients for making this work. One is country leadership or ownership. The second one is having integrated services that are accessible for everyone. And if this is about strengthening UHC, then the person-centered component is a self-care issue. So working from a very person-centered approach in integrated service delivery, we know very well there will be certain aspects that require exceptionalism for safety, for easier access, and we can make a case for those using the data and lived experience that we have, showing what has worked. We know HIV has not worked because there was treatment only. It's worked because of the other things that we've done to complement the treatment. Differentiated service delivery to reach people who are hardest to reach, addressing stigma and discrimination, literacy to move demand creation, and then the collaboration between people living with and affected by HIV and governments and healthcare providers, so that together, this multilateralism approach to address HIV as a collective, not one group versus the other. I think we can continue to model within that what we have been doing in HIV into broader healthcare. It may not be the one pill that fixes the whole global problem, but I think it's an entry point.
No, certainly, Florence, totally agree with you. And everybody, governments, we need to reflect. The HIV movement is the strongest example we have. So much to learn still. Okay, thank you so much, Florence. And with this, I move to Ileana. Ileana, I know you have touched upon it in your presentation also, but just to reiterate, like marginalized key populations often avoid formal health clinics due to the the stigma, fear of discrimination? In what ways do self-led diagnostics and prevention tools serve as the most effective vehicle to deliver UHC to communities? And please, some reflection on this.
Yeah, well, just quick, since I know we're getting to time, but I did just want to spend, some time talking about the importance of health literacy. And I think that educating, making health education a public priority is really key here. And it's not even just educating the communities about diseases and about managing, these diseases, but also training providers and community health workers on culturally appropriate ways to provide health services, to provide that kind of education so that communities are more likely to approach them, more likely to want to seek that information. I think that there's a lot of ways you can also provide services confidentially through like anonymous hotlines. So, and I know for a lot of people, that's a more comfortable way for them to seek information and to educate themselves. And I think when we talk about equipping people to make informed decisions about their health, I think using the appropriate languages and images and then receiving the information from people that they trust can really help tackle that barrier.
Thank you. Thank you so much, Ileana. Wonderful response. That is something we wanted to hear. And with this, I know we are just 4 minutes away. So quick, question, quick reflection from Karen. Like critics sometimes worry that decentralized health system might dilute the quality of care. And how do we put self-care models? And, you have shared it, but how do self-care support the overstretched health system? Yeah, just a last thought, like a quick second.
Yeah, this is a very important concern, and I think my answer to this is that self-care should never mean unsupported care or lower quality care. So well-designed self-care models, and we have these designed for HIV self-testing, but also for other self-care models, do not dilute the quality. They redistribute tasks. It's more like task shifting, task sharing, more intelligently across the system. So, for example, for HIV self-testing, that shifts the initial screening step to the individual, but uses quality assured products that are specifically designed and pre-qualified for self-test use, also answering the question that was mentioned earlier before, do we need specific training for this? No, these self-test kits have been specifically made for self-test use. But the wider system still provides the quality backbone. So clear instructions, also enhanced through digital AI enhanced tools that people can be used to be following the instructions for the self-test use, community and digital support where needed, confirmative testing for reactive results that has been provided by the health delivery system, linkage to ART, PrEP, PEP, and also referral for clients requires more complex needs, obviously, that is provided by healthcare providers. So it's not just dumping self-care to the self-user, but there's obviously an entire support system still based there. So it's more about shifting tasks, reduce the amount of the time for healthcare workers that's spent on routine, lower complexity tasks to, like, for example, initial HIV screening, to more complex tasks like linking people into treatment, providing post-test counseling, and so adherence support. Yeah, that's what it is. Thank you.
Thank you so much, Karen. And with this, we have come to end of our session today. Let our collective message to the UN General Assembly be, we are not arriving in New York to politically ask seat at the table. We are here to reclaim the table entirely. Yes, HIV, HLM, we are coming. Self-care is our bodily autonomy in action. It is our political resistance. It is the single non-negotiable path to achieving AIDS-free world by 2030. And our health, our rights, it belongs in our own hands. With this, I thank all of you for being here today. I thank our amazing panelists. I thank our, our team who supported us, and very, very, big thanks to Self-Care Trailblazer Group. We really worked hard towards it. It was an amazing session. And thank you so much. And if you have more questions, you want more answers, please write to us. Victoria has shared everything in link. Visit us, join us. We are a movement together. So with this, thank you so much, everybody. Bye-bye. Take care.